Hello and welcome everyone. My name is John Rickard, the Education and Communication Specialist with the Rural Health Transformation Center. Thank you to those who participated in our test poll. We will have other polls pop up throughout this webinar and appreciate your participation. Additionally, feel free to enter questions into the Q&A pod accessible via the control bar on your screen. We will leave some time at the end to answer questions. This is the 8th webinar in our series From Sticking Point to Tipping Point, Overcoming Rural Community Health Improvement Challenges. The previous 7 webinars are available for viewing on our website, as will be the recording of this webinar. A link to our website has been posted to the chat. You will also be receiving the link to this recording via a follow-up email. Now, on to the main event, Advocacy 101, working with local government to influence change. Today, we will be discussing how to navigate the decision-making structure of your local government, how to move through the policy adoption process, and tips for presenting your case to your local government. Here to share some expertise on the matter is Cindy Winters, the project advisor for the Rural Health Transformation Center. Cindy, the floor is yours.
Thanks, John. Thank you all for joining us for the next 30 minutes as we share some advocacy tips for working with city or county government. This is just going to be a brief overview of some of the information that was helpful when we were working to implement policy change at the city level. It is by no means comprehensive. That would be a much longer webinar, but it will contain some tips that we found helpful in our work with the Heart of New Ulm project. And this webinar is not going to address the grassroots work that should be done to gain community support for a policy or environmental change, but we have put together a handout with these tips that can be downloaded with the link when you receive the webinar recording information. We will share some of our lessons learned and strategies that we incorporated during our 10 years of the Heart of New Ulm project to address sustainability of our efforts and to reach those populations that are hard to reach and don't or can't participate in programming efforts. Generally, at some point in time, you want to work with your local government to adopt a policy that addresses either access to healthy food, housing, physical activity, etc. So in this webinar, we hope to give you some tips to make the process easier or at least less confusing and give you the confidence you may need to take an initiative to your city council or county commissioners for their approval and or adoption. And these lessons have come from our on-the-ground experience with the Heart of New Ulm project, a 10-year initiative to decrease heart attacks in the 56073 zip code. New Ulm is a small rural community of about 14,000 people located 90 miles southwest of the Twin Cities. The project began in 2009, and the research portion officially ended in 2018. The project is still growing strong as a fully community-owned and driven community health improvement initiative being led by an umbrella community leadership team and several action teams addressing specific challenges such as access to healthy foods and making it safer to walk and bike in the community. The Heart of New Ulm project was designed to apply and widely disseminate established, evidence-informed health improvement practices based on the community's own level of risk and customized to their preferences. To help set strategy, we first had to understand the community's needs. When the project started in 2009, we conducted community screenings to better understand the health and health behaviors of our target audience of 40 to 79-year-olds. The community diagnosis told us that 76% were either overweight or obese, 38% had metabolic syndrome, which puts people at risk for coronary heart disease and or diabetes, and we were about 10% higher than the national average. 17% reported getting the recommended amount of 5 servings of fruits and vegetables a day, and 64% reported getting the recommended amount of 30 minutes of physical activity per day. And these findings helped form the basis for decisions about how we set our priorities going forward and started to distill the basis for our messaging. We focus on the 40 to 79-year-old age because this is the age range that was most likely to experience a heart attack during the project's 10-year time frame. Our long-term goal was to reduce the number of heart attacks over the course of the project by addressing the 9 modifiable risk factors listed on this slide, because 90% of first heart attacks are attributed to these risk factors. Small changes in several risk factors can lead to major improvements in health at the population level. And we also use the social ecological model, which is a prevention framework that considers the complex influences on overall health to determine where and what evidence-informed strategies to implement. Reaching people in the various locations where they live, learn, work, and play, all the way from the individual level, which reaches a small number of individuals, to the policy level, that reaches the majority of residents in a work site, neighborhood, or community. We layered a consistent communication strategy with the various interventions to help motivate and to minimize confusion by providing clarity. By doing these two things, you're solving problems for your audience, lack of motivation and lack of clarity. Providing that value will increase engagement. Now, for a little bit about New Ulm to set the stage for our work. New Ulm self-identifies itself as the most German community in America, and most everyone knows Germans like to have fun. As a matter of fact, that's the Chamber of Commerce's motto: Germans have more fun. It's known as the city of festivals, and there is at least one a month, if not more. The 3 primary food groups when the project started were beer, brats, and butter. There was really no biking infrastructure to speak of in 2009. Longtime residents couldn't envision why change would be needed or warranted because when they were kids, you know, you've all heard those stories. So it's no different here in New Ulm. We had a lot of policy or systems work to do in order to maintain the momentum created by the research project to help keep the residents healthy. So we've been very successful in our work with the city over the course of the 10 years, considering we really didn't start working on policy change within the city until year 5 of the project. Needless to say, this work takes a long time, and you really need to start early in order to understand how decisions are made and the process you need to go through before you approach the city with any sort of policy initiative. It took 4 years to get our Complete Streets policy on the books, and it took a lot of partnership development and education to make it happen. For those not familiar with Complete Streets, it's a policy that states all users will be taken into consideration anytime any street or road work is done. It helps to ensure, if implemented, that our streets and roads are designed for people and not just the automobile. So this slide shows you the very first initiative that we were able to accomplish, and that was a mid-block crossing between the recreation center and the schools and the public health center. And this street is used a lot, and a lot of people cross it. So that mid-block crossing was our first success. And having an early first success really helps set the stage for future work that you want to do with your city council. So now we have a couple of poll questions for you. So we better understand where you are at in the process of working with your local government. So have you considered working with your local government to implement policy at the governmental level to improve health? Yes, no, or maybe. So if you could please answer that question, that'd be great. Awesome. 77% of you said that you have, 14% that said that you haven't, and 9% said maybe. Okay, so the next question is, where are you at in the process of introducing policy, ordinances, or conducting demonstration projects within your local government? The first option is you're not sure where to begin. The second one is you don't understand all of the steps to the process. The third one is, have you conducted demonstration projects? Fourth one, have you started to address some policy work? And the last one, you have been successful in implementing a policy or ordinance. Okay, 33% said that you're not sure where to begin. 17 said you don't understand all the steps, and believe me, trust me, I understand it can be really confusing at times. 6% have conducted demonstration projects. 11% have started to address some policy work, and 33% have been successful in implementing policy or ordinance. Great, that's awesome. Okay. So city councils and county commissioners are all made up of elected officials that are responsible for and should be responsive to the citizens that elected them. How they function as a governing body can and will be different in different locations, depending on the charters and state laws in your area. In New Ulm, we have a weak mayor system. The mayor doesn't lead the city council meetings. They can't introduce or second a motion. They're only allowed to vote if there's a tie, and they have the right to veto a motion if it passes, and they don't think it's in the best interest of the community. The key person in the New Ulm City Council is the president of the council. The president runs the meetings, sets the agenda with guidance from the city manager, and generally sets the tone for the meetings. The president is an at-large position voted on by all residents. The other council members are voted on by the citizens in their particular ward. Not all city councils or county commissions are structured the same, so it's important to learn how your local government is structured. You can learn more by becoming familiar with the documents that I'm going to introduce you to now. I'm not saying that you have to read them all, but you do need to know of their existence and where to find them, because these are the documents that dictate how the city or county is managed. All of these documents I'm going to talk about should either be on the city's website or on the county website. They may be buried because people don't generally go looking for them that often, but they should be there somewhere. And if you can't find them, ask your city or county administrator where they're located. So the charter is a document that outlines the unique set of laws that forms the legal foundation for the local system of government. This document generally isn't that long and doesn't seem to change very often, but it does state if the city or county has the power to set up different boards and commissions and what those commissions might be. That's important because the boards and commissions are made up of the residents of the community to address a particular topic. It's the government's way of getting citizen input on issues that come before the city or county. Depending on your city or county, a proposed policy, systems, or demonstration project may have to go before a commission before going to the city council. If the proposed item doesn't make it through the commission, then it probably won't get on the city council agenda. The city code or municipal code are the laws that the city or county enforce within their jurisdiction. This document goes into a lot more detail about the different components contained in the charter. City code is reviewed and updated much more often than the charter, so it's also a much larger document. The New Ulm Code Book is 388 pages. So if you have insomnia and counting sheep isn't working for you, you could always try reading your city municipal code. The New Ulm City Code has been updated 5 times since 1973 and is in the process of being updated again. Ordinances can become antiquated over time and should be reviewed and updated as the needs of the community changed. However, it's important to remember that there is no such thing as a perfect ordinance. The next document is the comprehensive plan. State laws tend to dictate how often a comprehensive plan is to be created and what size city or county is required to create a plan. In Minnesota, it's recommended that cities of a certain size update their comprehensive plans every 10 years. And this is a document that is created through a public process to get input from the residents on what they would like to see happen over the course of the next 10 years in their city. Some cities really use it as a guide to their work, and some cities go through the process of developing it, but don't seem to use it that much. The contents of the comprehensive plans have changed over the course of the past few years. On the left, you'll see what the general scope of the content has been in the comprehensive plan. And on the right, you'll see the new section titles that are starting to be included in plans. As an advocate, you can use these plans to help move your agenda forward if you can get some language included in the plan to address transportation needs, access to healthy foods, etc. Some comprehensive plans have a chapter specific to health, and others have weaved health throughout the plan, so the responsibility on health doesn't just fall to one city department or partner. Comp plans must keep up with our changing world. We shouldn't continue to shoehorn our complex world into comp plans, into the current setup of comp plans. Comp plans should mold to our world, and this requires us to consider including information on the topics of today while keeping the traditional planning topics for elements. If you're planning on working with the city or county on street improvement work, you need to be familiar with the SIP or Capital Improvement Plan. This description for the SIP was adapted from the SIP description written by the senior city engineer for the city of New Ulm. In New Ulm, the SIP plan generally contains the plans for upcoming street and alley improvement work planned for the next 3 years. The most current year details the work needed, estimates the cost of the work, and identifies the funding source. The subsequent years contained in the SIP plan are less detailed, but do highlight the planned street work proposed for the next 2 years. If you're planning to impact any street work to incorporate changes in the design by incorporating traffic calming measures, it's important to know what's contained in the SIP plan and to intervene early so that those changes can be considered. The farther out you can intervene, the better chance you'll have in being successful in making changes to the plan. State DOTs create SIP plans are much farther out than local governments, so being aware of the SIP plan for your area is critical for successful advocacy efforts when making changes to the built environment. At the local level, SIP plans can change as well. An example of that is the Safe Route to School team in New Ulm has been keeping an eye on the SIP plan for reconstruction work on a particular street past one of the schools. The city engineers have agreed to incorporate traffic calming measures along the street when it's reconstructed. The street was initially included in the SIP plan for this year, but it ended up getting pushed back because another street reconstruction became more critical and ate up the proposed budget. The street we want changes on keeps getting pushed back and is now in the SIP plan for 2020, but we've been told it will most likely get pushed back another year due to more urgent street needs. The SIP plan can be found, or at least should be found, on the city or county website. The state DOT SIP plans can be found on their website. When working on making street improvements, it's important to know who has jurisdiction over which streets or roadways in your community. It's important, it's probably a combination of state, county, and city. Once again, this generally can be found on the city or county websites, and it's also listed in the city comprehensive plan. Okay, now for the helpful hints. I'd like you to meet Dan. Dan was the city council president for 20 years in New Ulm. Rather than read through all the documents that I just shared with you, I went to Dan. He no longer serves on the city council, and he is a big supporter of the Heart of New Ulm project. He was the chairperson of the Heart of New Ulm leadership team for 3 years. He was my go-to guy to learn about how the city and city council functioned, who was or is the main gatekeeper, What's the best way to influence the decision-making process? Who do I need to meet with? What commissions are involved in the decision-making process before it gets to the City Council? He was so helpful in helping me understand the ins and outs of New Ulm City government. He was very open and helpful. You need to find your Dan, your go-to guy or gal. Someone's brain that you can pick and get their honest opinions on whether they think what you're proposing is a good idea, if there would be support, and where you need to go to get that information. The role of the city manager or the county administrator is the day-to-day management of the city. The city manager and the city administrator have the day-to-day management of the city. They work for the city council or the county commissioners. They're sometimes referred to as the chief executive officer. It's important to understand where the city manager stands on certain issues since they highly influence the city councilors and or the commissioners. They're the ones that primarily prepare the council and commission agendas with the council president. So if they don't feel an item is appropriate for the city or county to tackle, they won't put it on the agenda. Developing a working relationship with these individuals is very important. You want to be respectful of their time since they tend to be very busy individuals and have to keep a lot of balls juggling at once. I've had experience working with a couple of different city managers, and those experiences were vastly different. One had been in the position for a long time and was cordial during our visits, but wasn't exactly open to many changes to city ordinances or policy. His primary focus was on the financial health of the city, which he was really good at, but it was difficult to get things on the agenda if he didn't agree or see the need for them. Our newest city manager is fairly new to the position and is much more open to change and willing to bring items before the city council in work sessions to get a feel for how the councilors feel about an issue. But you have to keep in mind who they answer to. They answer to the elected officials, so they basically have to keep the majority of them happy or they'll no longer have a job. One way to determine the pulse of the city council, county commissioners, and the manager or administrator is to attend their meetings. Nearly all city council and commissions meetings are open to the general public. They have to be advertised in the local paper and on the city or county website. You can sign up for email notifications of the meeting with a link to the agenda. The only time a meeting may be closed is if they're discussing personnel issues, then they'll close the meeting. I attend most of the meetings and several of the city commission meetings. As a matter of fact, I was at this city council meeting, and trust me, the room usually isn't that full. I do it because I am a government geek, but I also do it because I want to understand the process of city council meetings. I want to understand the group dynamics of the council and commission members, and I want to know what the council members are concerned about and how they talk about the various issues that come before them. That way, I'm better prepared to present my case to them when I do have something on their agenda. If you don't want to go to the meetings, some councils live stream their meetings over the internet. Others show them on their local access TV cable channel and post them to YouTube following the meeting. I cannot tell you how helpful it is to understand how the city council functions during their meetings prior to bringing your case before them. Who sets the tone for the conversation? Are the city councilors independent thinkers and voters, or do they follow the lead of a particular council member? What questions do they ask? If the city council has work sessions, those meetings are also open to the public. I attend most of those as well. I think of it as my cheap form of entertainment. They can't make any decisions during the work sessions, but they work through issues and make a plan on how they will proceed at the next city council meeting. Another benefit I've found from going to city council meetings is it often gives me opportunities to meet and talk with some of the city council or city staff members that I might have a hard time catching in their office because a lot of them attend those meetings. When it's time to present your policy, system, or demonstration project proposal to either the commission or the city council, you need to get the agenda on the item on their agenda. You need to determine what your timeline may be and when you need to present the information. Find out who puts the agenda together and when your information is due to that individual so it makes it on the agenda. It's always a good idea to give your contact at the city, assuming that you've created one, a heads up that you're planning to present the information so that you can help navigate the system. They can help you navigate the system to get it on the agenda in time. An example of this is the New Ulm City Council meets twice a month on the first and third Tuesday of every month. To get an item on the agenda for City Council meeting, it has to be in the City Manager's office the Thursday prior to the Council meeting at the latest. The agenda public and applicants to review it. The commissioners, on the other hand, only meet once a month. Sorry. So scheduling those two can be challenging. So you need to keep track of when meetings are happening so that you can make sure that you can meet your deadlines when you're working with the City Council to get things on commission agendas. And the city has been really good to work with if if they aren't having a commission meeting, because not every commission meets every month. But I try not to abuse that relationship that I've created with the city, and I try and follow their guidelines as closely as I can. So you may be asked to complete, when you want to put something on the agenda, you may be asked to complete the request for council action form that the City Council uses to move items forward during their meetings, or the staff person preparing the agenda will complete the form. The request for council action form itself will vary depending on the organization that you're working with. And it's important to keep all of the information you share, both in written and verbal form, concise and to the point. Council packets can get quite large. It's not unusual for the packets to be up to 200 pages or more. And it's important to provide some brief background information, the purpose and information needed to make an informed decision. It's helpful to have your talking points typed up so that you stay on point. When preparing your talking points, try to anticipate what questions you may be asked. That's why it's helpful to attend or watch previous council proceedings so that you can anticipate potential questions and provide the information in your talking points. You don't want to be long-winded because some council meetings can get long, and depending on where you follow the agenda, the council members' eyes could be glazing over and you may lose them. Be respectful of everyone's time. If you don't know the answer to a question, tell them you'll find it out and get back to them. When it's appropriate, we've created a one-page, two-sided fact sheet with bullet points and graphs to tell the story of the data and to help set the stage for the ask. This is generally sent out with the agenda packet so that the counselors have time to review it prior to the meeting. Some helpful tips that will help you navigate the governmental system in your area and help you gain the respect of the council and commission members are: know the budgeting cycle. If your initiative will need funding from the city or council, you need to know their funding cycle and when budgets are developed and finalized. Attending the budgeting council meetings has been very helpful and has put some of the Heart of New Ulm project requests into perspective. You need to understand the budget implications and the long-term maintenance of replacement costs. When asking for infrastructure changes to the environment for bicycling and walking, those changes have long-term maintenance costs. Incorporating traffic calming measures during traffic reconstruction is the most economical time to do it, and will most likely be received well. While paint is about the cheapest thing a community can do to improve walking or biking, it all adds up and needs to be redone on a regular basis. Understand the limitations or where the opposition is coming from so you can make a legitimate argument or go back to the drawing board. And sometimes it's going to take a staff change before changes can be made. Be sure to ask questions even if you think you know the answers, because you may be surprised by the answer. Keep your cool and don't get defensive. You want to make sure that you follow through. If there's questions you don't know the answer to, get back to them. And then having one-on-one meetings with counselors and or the city manager and commissioners has always proven to be very beneficial for us. You want to work on developing a working relationship with city staff. You want to know where to find those documents that I talked about. find your go-to person, watch or attend city council or commission meetings prior to your particular ask, know your timeline in order to get items on the agenda, be prepared for your presentations, prepare talking points, and when you go to city council meetings, listen, and really listen to what they're saying and and trying to anticipate what they're thinking. I know we're really running really close on time. So working with city and county government can be frustrating at times, but it's also very rewarding. It's well worth the time and effort you put into the preparation in developing those relationships and understanding the system. Here's my contact information and the links to our website, Twitter, and LinkedIn accounts. If you have any questions or want more information about the Rural Health Transformation Center and the services that we provide, all of our previous webinars are archived on our website as well. Now, I don't know that there's time for any questions, but are there any questions in the queue, John?
Yep, it looks like we have a few questions loaded up. So if we have a little bit of time, let's go ahead and answer some of these. So the first one is, our organization tried to introduce policy change to our local government and we failed. So does that mean that we should give up?
No, absolutely not. Just try and figure out where the gap was. Maybe you didn't have enough community support, or you didn't understand the issue from the counselor side as well as you needed to. But yeah, go back to the drawing board and figure out what you can do better next time. And time is, some things just take time. It took us 4 years to get our complete streets policy, and sometimes you just have to bide your time and figure out when the right time really is.
Mm-hmm. Thank you very much. Looks like we have one more question in the Q&A pod, and that is, have you experienced a situation in which the local government you were working with disagreed with the policy that you were trying to implement?
Honestly, that has not happened. Well, okay. An example, yes, we are trying to implement now a Tobacco 21 policy at the local level, and we have heard through our grassroots efforts and campaign that one of the city council members believes that it's a state issue and not a local issue. So I don't know that they're against the policy, but they just don't think it's their role. So and we haven't gone in front of the city council yet to ask them about adopting an ordinance or requested an ordinance. So now we can really meet with that individual and find out and work on ways to help influence or help change their mind. And we're also working with the other city councilors and finding out whether they're in support of it, and do they feel it's a local issue or a state issue.
Excellent. Thank you for sharing your expertise, Cindy. And that's pretty much all the time we have. So sorry if we didn't get to your questions, but we can definitely follow up via email if you have additional questions. And I see that one was just entered in the Q&A pod, so we'll for sure get back to you on that one. But I'd just like to say thank you again for joining us. You can get more information about the Rural Health Transformation Center and access all of our tools and resources via the first URL link in the chat pod. And if you're interested in our work and would like to receive more information, or if you have questions, feel free to email us at populationhealth@mhif.org. Once again, that's populationhealth@mhif.org. Thank you again and have a great day.